So it gives me great pleasure to welcome Lindsey Burghardt. Welcome.
Thank you.
I know this is not
Thanks
a new
for having
building
me.
for you,
No.
so
It's good to be back.
She's a Chief Science Officer at the Center for Developing Child at Harvard University. If you don't know, it's an institute across the river on the other side of the world. Founded by a colleague and a friend of mine, Jack Sheung, and Lindsey has a very interesting background. She's the founding director for the Center's Early Childhood Scientific Council for Equity and Environment. Even though equity is a four-letter word,
Yeah.
we continue to use it. The problem has not disappeared, right?
No.
It's a multidisciplinary group that synthesizes and translates scientific mechanisms related to many ways that the built and natural environments impact children's development and lifelong health. I can go on and on. She's extremely well accomplished. She's a pediatrician, so she has another life, I guess. In addition to the work, she's doing amazing work for the center. And this is as a part of the Sheung Center for Health and Happiness, which is what this seminar, we are hosting this seminar. So I want to welcome all of you and those also people on the web. I'm looking at the camera. So, and we will come back with an announcement for the next seminar. But just wanted to add one point, that is, this is a continuing series of seminars we have been holding. These are always thematic. So last year it was about social connections. This year it's about built environment and happiness. And so Lindsey was brought in as a part of that theme. So thank you so much for coming and talking to us.
Yeah, well, thank you for having me. Thank you for organizing this great series. I've really enjoyed it. I wanted to start with a minute of gratitude because I feel like I sat in those chairs as a student, and to be able to stand up here and talk to you about all the things that I love for an hour, it's just a very, very nice opportunity, and I appreciate it very much. And we're going to push the limits of my mental, physical coordination today because I have to advance in two places. So you guys keep me honest if what I'm talking about doesn't track. So the title of my talk is What Surrounds Us Shapes Us. And I'm going to talk about this idea of a developmental environment that I'll explain a little bit more as we go on. But if you have questions, please feel free to stop me. And I'm happy to make this interactive. It's working so far. All right, so to start, just briefly, the Center on the Developing Child is an interfaculty initiative. So we actually sit jointly between the Graduate School of Education and the School of Public Health. Bridges two great loves for me. And the mission of the center really is to leverage what science tells us, what's in the peer-reviewed literature, and what we understand in pursuit of better outcomes for young children, especially those who are facing significant adversity. And so our goal really in doing that is to catalyze changes in policies, in services, and in funding, all in the aim of making things better for young children and their caregivers, and creating these environments that really support children's health and their well-being. So the science synthesis that our center does is in large part done through the amazing efforts of these people on the screen. We call them the EGSI Council. Two of them are members of the TH Chan School faculty, but they're interdisciplinary. They come from a range of expertise and a number of different academic institutions. And they're experts in neurobiology. We have an amazing social anthropologist who's an expert in strategic health communications. There's people with expertise in life course pulmonology and adult pulmonary physiology. Obviously, Dr. Nadeau is a huge climate expert and environmental health scientist, as is Dr. Payne Sturgis. And then there's people with expertise in social and contextualizing factors on health and on pediatrics. And so each of these people do incredible work. So if you're interested in what I talk about today, I really encourage you to check out their faculty websites and learn more. So when we want to understand really how and why environments are shaping children's development in unique ways, we need to start broadly, right? First, by thinking about everything that influences development. And in kids, well before they're born, so actually even surprisingly well before they're conceived, their development is shaped by this full range of exposures that they have, not only in the social environment with their caregivers, but in all the places where they're living and learning and playing and growing. And so we call the totality of all these things the developmental environment. Now, early childhood is a really, really special time because during this period, infancy and the first few years of life, biological systems are constantly reading the environment. They're developing very rapidly, and they actually develop in response to what they read and what they encounter. And there's, for example, there's studies that suggest that early life exposure to air pollution may affect the likelihood of a child developing asthma later in their life. And this may be because of pathways like inflammation and altered immune development and increased allergic sensitization in children who have a genetic disposition. So that's just one example, but developmental environments can also contain exposures and experiences that fuel positive development, right? Access to clean air where you breathe, supportive and consistent and reliable caregiving, high quality early care and education, access to green space, a comfortable temperature where you sleep. All of these things really matter. So developmental environments as a whole shape a very wide range of outcomes for young children, both in early childhood, but actually also in terms of the adults that they become. And this includes their physical health, but it's also their mental health and their social emotional development and their learning. So where we live as young infants, tiny little babies, affects what we're exposed to, what our developing biological systems come in contact with. And it affects the experiences that we have. And this in turn affects development. So for example, if you think about a child who lives in a neighborhood with a lot of green space, on a day when it's very hot, that child will have access to cooler temperatures, may still be able to go outside, may still be able to play and explore, may have different behavior when they come back indoors at the end of the day than a child who lives in a neighborhood with a low prevalence of green space. So we're really starting to understand now from the work of many, many incredible people how these different aspects of the built and natural environment are either protecting or putting children at risk from different environmental exposures and experiences. Now this really matters because when we then think about what we all care about, the solutions, how do we make things better for young kids, I really want to argue that there's a much broader set of policy domains that factor into how we can protect kids. It's not just pediatrics. It's not just people in early care and education. It's all the people who influence and who shape these developmental environments. So when it comes to the effect of these built and natural environments on kids, one way that these exposures are really, really unique and how this is different than in adults is that timing in kids really, 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 really matters. And this informs the solution space again. So we're all sensitive to environments, right? If this room was 100 degrees, you'd all be much less interested in what I had to say. It matters for all of us. But development is a time that is especially sensitive to what changes in our environment. And it evolves in ways that makes actually specific age ranges really especially sensitive. And so what this means is that the exposures and the experiences that kids have in developmental environments during this time are really powerful in influencing their health because of that biological sensitivity. So in general, the prenatal period, the earliest days of the prenatal period, are going to have that greatest biological sensitivity. And in general, the prenatal period is more sensitive in terms of biological systems than infancy, and infancy is more sensitive than early childhood. And adolescents, though, are even more sensitive to most of these exposures than many adults. And so this differential sensitivity comes in and is really, really important because for kids, it's not just what they're exposed to, but it's actually when they're exposed that helps influence the outcomes that they have. So this is, again, really exciting because developmental science is not just telling us whether we step in to help children that matters, but it's actually informing when we can intervene and when we can support children to make a really important gains in these really specific outcomes that we care about. There's also this good news, bad news about this differential sensitivity, right? The good news is anything we do to protect people during pregnancy from these adverse exposures or to increase the predominance of positive exposures is going to have an outsized positive effect on all the outcomes that every policymaker cares about across the life course, whether you're thinking about social and emotional development, learning, cardiovascular disease, diabetes, neurodegenerative disease, cancer, it doesn't matter. But then the converse is also true, right? If we don't protect people during pregnancy and in the earliest days, we're also likely to see an outsized negative effect on all of those outcomes, again, because it's such a sensitive time in development. So every environment out there is infused with this combination of positive and negative influences on health and development. And it's probably not a surprise to the people in this room, but I think it's important when we talk about developmental environments to our colleagues to really highlight how these levels of exposure to hazards and access to opportunities are not currently distributed equally among children. And so the qualities and the conditions of places where children are growing up are really deeply rooted in our public policies and in our social history. And there's two major influences, systemic influences on developmental environments that I want to talk about today. One is systemic racism and the other is climate change. Oh, is it tracking? All right, so getting more precise about these inequities is really helping us to understand where we can step in and where we can target and direct our resources to make things better and have the greatest impact on young children. So the Child Opportunity Index was developed by our colleagues at Diversity Data Kids. It's in its third version now. And this is a composite index, and it's really exciting. And I'm going to do a little bit of a deep dive on the COI for you all because I just think it's incredibly informative. And there's something like 90+ studies that have come out of it now that just tell us with an incredible amount of detail and understanding how children are experiencing place. So the COI is really cool because it maps all the qualities and resources and conditions in children's neighborhood, but it's an aggregate index. And it looks over 9 years, 2012 to 2021. There's 44 different indicators in a number of different domains and subdomains, but it's really letting us get more and more precise about quantifying both negative and positive exposures in developmental environments and their impacts. So the COI looks at like all these resources, all the conditions in where children are living, things like their proximity and access to green space, which they measure via nature score, but also things like exposure to PM 2.5 and ozone and extreme heat. So it's really helpful because it recognizes the compounding benefits that multiple sources of advantage provide, and then also the compounding risk of multiple sources of disadvantage. So it's going to identify, for example, neighborhoods that have access to better educational opportunities and higher quality health care and high quality early care and education and healthier physical environments, as well as these economic and social resources. And then again, this is really important to understand because it's going to let us identify where we can target our resources to best invest and protect kids who need it most. So, there's a lot of research and a lot of discussion about neighborhoods and children's health. And there's a part of the COI version 3 report that I encourage you to check out because I think it's really insightful and important to pause and take a minute to think about it because, they talk about there's a lot of focus on children's future outcomes, right? We want to talk about their economic success. How well do they do in school? Like, what is their risk of cardiovascular disease in adulthood? And these are all really important, but we also, I think, really need to take a minute to appreciate childhood for what it is and actually protect childhood for what it is. And that means, considering what it means when you're playing and learning and growing. Those things are not necessarily a means to an end. And so this quote from the IOM really gets at what it means to grow and thrive as a child, right? It's that ability to be in an environment where you can take in and process and learn and explore and do all of those things in a way that really promotes your whole development. So I think it's just a really important point to make that kids actually deserve to thrive as children, not just in service of them becoming the best adults that they can be. The pediatricians in the room hopefully will agree with me. So these are dots that show the 100 largest metro areas in the US according to the COI. And the darker the blue, the higher the opportunity. The darker the red, the lower the opportunity. And I think this is a really interesting map to pause and take a look at because it shows, look how dramatic the geographic differences are across the United States for these 100 largest areas. So look at where we are in New England, check out the Great Plains states, it's very blue. And then look at the Central Valley of California and the southern states. There's some of the lowest opportunity scores in the country. Now, it's really interesting. If you were to zoom in at the local level, even within places that are half a mile apart, you'd see really dramatic differences between really dark blue and really dark red right next to each other. And so it's just really paints a really precise picture of understanding where kids have this access to opportunity. Now, COI scores, again, range. 0 is very low, 100 is as high as you can get. When you look at the distribution of these scores across the country and how they affect all of these kids, the index shows that Black and Hispanic kids are more than 7 and 5 times more likely to live in very low opportunity neighborhoods compared with their white or Asian peers. And so if you look at the Milwaukee metro area, for example, the typical white child lives in a neighborhood with a COI score of 85, and the typical Black child lives in a neighborhood with a COI score of 6. So throughout the country, these patterns are really consistent in that Black and Hispanic children live across the country in neighborhoods with much lower COI scores compared with white and Asian children. Now, what the COI is really laying bare are these effects of structural racism and how they're playing out in neighborhoods for children. And what this means is that these minoritized children are being exposed to more excessive heat and toxicants like air pollution, and they have less access to these positive influences like clean water and green space. And so these exposures really are what's contributing to the higher rates of many of the adverse health outcomes that we see. And so, for example, when we're studying and talking about racial and ethnic disparities in, say, like asthma, with Black children having significantly higher rates of asthma compared with their white peers, these are differences in the lived experiences of these children in their developmental environments. It's not due to any underlying genetic difference. So I wanted to take a minute to highlight this very cool and local program that's also in the COI version 3 report if you're interested in learning more about it. It's called Supporting Neighborhood Opportunity, SNOMAS. And this is a very interesting program that helps families with children who are eligible for housing choice vouchers to relocate to designated opportunity areas that were identified using the COI. And so it helps the families identify the neighborhoods, it helps them with resources and finding housing there. They get financial support for security deposits, for moving costs. And again, like, we shouldn't ask families to move who don't want to move, but for those who do want to move into different opportunity neighborhoods, this is a program that really facilitates that. And since 2019, they've helped 125 families, 270 kids in total, to move to higher opportunity neighborhoods through the program. And there's some really interesting interviews with the families that show that they really do have improved mental and physical health after they move to these higher opportunity neighborhoods, and they voice things like better educational opportunities and easier ability to access green space, and the majority of them voice that their new neighborhood is really inclusive and welcoming. Very few report drawbacks for themselves or their kids in terms of the move. So the COI authors have identified a couple of key policy areas that could really improve child health outcomes. They're in 3 big categories. My favorite one is poverty reduction. If you've ever heard Dr. Mona, who uncovered the Flint water crisis, talk about her new program, RX Kids, she says when she sees patients in her clinic, she always wished that she could write away a prescription for poverty. And so RX Kids is an incredible program that's doing that. The COI authors, describe how the expansion of the child tax credit in 2021 demonstrated that if we have a really ambitious anti-poverty policy, we can really reduce child poverty in an equitable way. And a new expanded version of this, I think, with really meaningful design elements could really meaningfully decrease child poverty in our country. In terms of housing, historically, I think a lot of us here know that U.S. housing policy has created the segregation in where children live by race and ethnicity, but also by socioeconomic class. And so equitable housing policy from the federal government that really affirms these fair housing rules could make a lot of gains for children, and state and local jurisdictions, I think, limiting restrictive zoning laws that either don't allow children because those exist, or that don't allow the building of multifamily homes are really important to make sure that we're eliminating, and then making sure that these high opportunity neighborhoods are available for families to move, and that we're able to build places for young children, especially close to public transit, that's going to allow people to get to their jobs. And then the final category is education. So residential segregation and school segregation are, of course, deeply intertwined in our country, and it's very, I think, complex, but in terms of school finance reform, I think that this could go a long way, and it's helped to equalize funding for children, but it's not enough. And I think creating equitable educational opportunities for young kids is going to require really progressive changes in the way that we fund our schools. But school desegregation programs, especially those that allow children sometimes to attend schools that are not in their immediate neighborhood, can be a really fast and accessible way to get kids into higher opportunity areas. And I think if we incentivize these and promote them, they have a lot of potential. All right, so the other systemic force that I want to talk about that's shaping developmental environments, I guess it's like another 4-letter word, as you say now, is climate change. And when it comes to kids, the effects of climate change are both direct on their biology, but the really important ones that I think we need to pay a lot of attention to are all of the cascading and indirect effects on kids. So we could talk about direct effects of climate change on children's biology all day. This is children experiencing flare-ups of their asthma from heat or from exposure to wildfire smoke, or drinking contaminated water as a result of the cascading effects of climate-related water implications. And then the indirect effects they're many, many. And this would be something like your caregiver getting heat stroke or heat stress and not being able to care for you, or being displaced from your home because of an extreme wet weather event and your caregiver loses their job and they're not then able to provide your basic needs like responsive caregiving, a bedtime routine, but then housing, stable access to food, the ability to attend school, the ability to go see your pediatrician and get your vaccines on time. These indirect effects are really, really important, and they cascade across children's lifetimes. So there's a couple of aspects of climate change, developmental environments where climate change is having particularly strong effects. There's 3, air, particularly with wildfire smoke, and worsening of both outdoor and indoor air quality. If you're interested in more on indoor air quality, we have an upcoming paper that'll be released from our center, from our environmental council, and then also a brief that we published recently on how wildfire smoke affects young children's development. That's on our website if you want to read more and check it out. There's also incredible resources through Joe Allen's Healthy Buildings website here at the Harvard Chan School, and then Sea Change has some incredible resources on their website as well about the effects of these things on children. Water, it comes to cascading effects like I talked about, both water availability and under-availability with drought affecting kids in a number of ways. And when it comes to temperature, we talk a lot about extreme heat, and I'll mention it a little bit today, but also extreme cold has an effect on children's development and on their developmental environments. So first, when we think about air, it shouldn't be a surprise that clean air is going to promote children's healthy development, but it's really important to understand here that infants in particular and young kids are more affected by air pollution than many adults. And this is true when it comes to wildfire smoke too. And this has to do with that unique physiology that I talked about earlier and how sensitive the developing respiratory system is, the developing immune system is to changes in air quality. So kids breathe actually more times per minute than most adults, and they inhale a larger volume of air relative to their body size. So wildfires are important because they generate these like tiny, tiny particles that travel really great distances. And in kids, they can affect the health of children over a really wide geographic area. But when children breathe in wildfire smoke, it's different than us because the fewer the particles are trapped in their lungs compared with ours, and more of them can make their way into the small airways where they can cause children to develop asthma, pneumonia, bronchitis, a number of respiratory outcomes. And then exposure to wildfire smoke is actually causing more kids to develop asthma. So it's not just the ones who already have it making it worse, but it's leading to the development of more children with the condition. And there's studies that have shown that actually exposure to PM 2.5 and carbon monoxide and ozone over time is linked to something called DNA methylation, which actually can lead to the way that your genes are expressed. And this is really important and kind of a moment because these changes can actually be passed down throughout generations. So it doesn't just affect you, but potentially the health of your children and your grandchildren. So air pollution exposure also, really interestingly, and some of these studies were done here at Chan, correlates with an increase in the type of white blood cells that play a really key role in the buildup of plaque in our arteries. And so if you think about this happening in young children, they have a much longer time to live until adulthood. So when they have these repeated exposures over their lifetime, we can just think about that compounding risk. Now, it's really interesting in that wildfire smoke, and this is maybe surprising a little bit, affects learning. So in a nationwide study, they looked at exposure to wildfire smoke in the year leading up to a test, and actually like the more smoke kids are exposed to, the lower their test scores are on average. And then exposure to wildfire smoke during pregnancy is also really important, and I'll get into that a little bit next. This is my favorite thing to talk about, so if anybody has a question, we can talk about this here. So exposure to wildfire smoke is kind of wild because there's increasing and growing evidence that this may increase the risk of preterm birth. And there's other pregnancy complications where there's some data accumulating as well, things like preeclampsia and low birth weight. And these are definitely areas where we need more of the smart people in this room to do some research. But preterm birth is really, really important to understand because it's not just about being born early in that moment. So if you're born too early, you have a higher risk of dying in infancy, of being readmitted to the hospital, having trouble with feeding, having trouble with jaundice, and that's all important in the neonatal period, but those children also have a heightened risk of a range of adverse conditions across their lifetime. It's not to say that there aren't probably very many healthy ex-premature babies sitting in this room today. Many of them do quite well, but they do carry this increased risk of trouble with cognition and difficulties with growth and a heightened risk of respiratory disease. Now, there's preterm birth is this outcome that can have a lot of different drivers, and there's not one clear cause. This is, again, a place where a lot of smart people are working to build our understanding. But it may be because of inflammatory responses. I sort of feel like, I don't know if those of you who also love science, if you don't know, the answer probably is inflammation, as well as like oxidative stress, and maybe there's effects on the placenta. So there's also really sort of disturbing evidence that some type of PM2.5, black carbon, can actually cross the placenta, and it's been identified in fetal tissue. And so I think there's still room to understand what the implications and what the outcomes of that are, but it's probably not a good thing. And then in terms of the magnitude of the problem, there's probably somewhere, I think the numbers vary, but 300 to 400,000 babies born prematurely in the U.S. every year, if we think about premature birth being birth that happens before 37 weeks of gestation. And of course, those rates differ, with being much lower in white pregnancies and much higher in black pregnancies. But if you take 300 to 400,000 kids and increase that number just a little bit, that could have huge implications for public health, not just when those kids are born, but also across their lifetime. All right, so our bodies need this near constant supply of water to be healthy and to thrive, and this is a really critical part of the developmental environment. It's especially true during the prenatal period and during early childhood, because again, this differential sensitivity makes our organ development during that time especially sensitive. So because kids' organs are developing so rapidly, they actually require more water than adults. And they're more sensitive to what's in that water. And so the organs absorb everything that's in the water we drink. And so if you're a young child and you're developing really rapidly, that means you get all the good stuff, like the beneficial nutrients that might be in your water, but also the toxic metals and the chemicals. And a lot of these, including things, materials like PFAS that many of you are probably familiar with, can even cross the placenta and reach the developing fetus. So when it comes to water, these events obviously becoming more frequent and more intense can have direct effects on kids. So they can suffer injury, they can drown, they can have the same effects as adults. But the stress and the trauma from displacement and predictability actually has been shown in some studies of older children to cause changes in the architecture of the developing brain. So this can lead to higher rates of mental health disorders and things like anxiety and PTSD. And then you think about these water-related effects also having these indirect effects on children if you're displaced. I mentioned this earlier, and there was a study in Nature in 2024 that looked at, and I think the study got a lot of attention, so you may already be familiar with it, looking at what is the mortality after all of these cyclones or extreme wet weather events in the United States, not only in the moment, but in the 15 years after the events. And they were able to look back for decades, right, at all of these hurricanes that happened in the U.S. And we report, say, on average, something like 24 deaths, which is terrible to the federal government in the acute setting. But this study looked and showed there's something like 10,000 deaths that were in excess of what could be expected based on typical mortality alone that was directly attributable to the hurricane. And there was some very sophisticated modeling done in there that I will never understand, but I bet you guys can. And it was incredible because they fractionated it by age. And if you look at the age group with the highest risk of increased mortality for 15 years after these cyclones, it was children under the age of 1. Now, it's really interesting because they were able to understand and hypothesize for the adults a lot of reasons why that might happen, right? It may be that you couldn't get access to your medication, or maybe you lost your home. But we're talking about 15 years after a hurricane, and increased mortality 15 years out here in a child under 1. That means that there was at least a decade, if not longer, for some of these children before they were even conceived after these events occurred, and they had higher mortality. So that's why I think it's really important for us to dig deeper and to start to understand and really get more specific about some of these indirect effects, because they're not trivial and they're leading to really increased mortality in children who obviously have a low risk of mortality to begin with, and that influences, of course, the fact that they have higher risk as well. But I just think it's a space that's really interesting because we sort of chalk it up to environments, but what does that really mean? Now, for extreme heat, in the news and in policy circles, I think it's very important and appropriate that we hear a lot about the impacts of extreme heat on the elderly. And we talk a lot about populations as a whole, but if we start to think about the specific effects that kids have on prenatal, that heat has on prenatal and early childhood development, I think it actually opens up this huge solution space for how we can shape developmental environments to protect kids. And so our bodies all respond to heat similarly. You know, we redistribute blood flow to the skin so that heat can transfer out of our bodies, and then we sweat. And this blood flow method is especially important in infants because they don't sweat as much as we do. But that method only works if your ambient temperature, the temperature that surrounds you, is lower than your core body temperature. So when the environmental temperature becomes very, very high, infants can't cool themselves as effectively as we can. And actually, their little bodies heat up more quickly than ours do. And so it's really important to consider, too, they can't seek out these cooler environments without our help, and they're dependent on us for their fluid and their other mitigating factors. Now, in kids, a lot of the effects of heat are invisible. And I think this may be what results in them getting less attention from different circles. You know, there are a lot of people who are talking about this, but I would love it to be more. I think when we do draw attention to some of these effects, it again points to a lot of potential solution spaces. So, you know, in addition to these direct effects, there's effects on fetal development, on learning loss, on sleep disruption, and on mental and behavioral health. And luckily, there's things that we already know work, and there's a lot of communities that are implementing solutions in each of these spaces already with good effect. So briefly for fetal development, you know, there's increasing evidence that during these times of high temperature and including afterwards, there's higher rates of premature birth. And you know, there's some physiologic changes during pregnancy that already put probably the pregnant person at a greater risk, and we're still understanding again with respect to that physiology that underlies preterm birth, what the exact mechanism is. But these protective adaptations during pregnancy can easily be overwhelmed during times of extreme heat. And again, this is a time where it's really that outsized good news, bad news effect. So if we really want to do really targeted intervention to help a large number of people be protected from the effects of heat, rather than thinking about our population as everybody's the same, when we start to think about these differential effects on pregnancy, we can say if we protect people during this really sensitive period, fewer babies are going to be born preterm. And so then that effect and those benefits are going to cascade again across their lifetimes. So heat and learning is really interesting. I think a lot of us have experienced this one ourselves. You know, if you're in a hot classroom, you can sort of feel a lot of these things that scientists have also quantified in more specific ways. But, you know, it just makes you feel unmotivated and you're distracted, and I get super irritable. So, you know, if schools are uncomfortably hot, students aren't learning as well, and we think about how that affects behavior. If you've ever been in a really hot room with young toddlers or young school-age children, you know deep inside what this feels like. It's very different than being on a blanket under a shady tree with a cool breeze flowing. And so we saw it this past year and in the year before in Massachusetts, when it's too hot outside, places like where we live are not designed to be cool, right? They're designed to keep heat in. And so if schools are too hot, they're forced to close for days at a time, and then we get into those indirect effects that we talked about before. And this is really important because the number of missed school days and those learning losses on hot days are going to increase probably if we don't think about how we adapt our schools. And so there's a good news too. You know, you can actually improve student performance with cooling. So on average, there's one study that was very cool. It showed you could likely, if you lower classroom temperatures from 86 degrees Fahrenheit to 68 degrees Fahrenheit, you can improve student learning and performance by about 20%. So that's great, and that there's something we can do about it. Now, sleep is a pillar of health. We all know that getting good quality sleep is really important. Psychologist Lisa DeMora says it's the glue that holds us all together. I think we can feel that. But for infants and young children, it's also really important. So chronic sleep deficits in infancy can raise the risk of kids developing a number of emotional and behavioral challenges, as well as adverse physical outcomes throughout their lifetime. And temperature actually plays a really important role in our sleep. So we all think about light being important, but there's actually a drop in your core temperature that happens that helps to facilitate sleep onset. So if that core temperature drop can't happen, you know, it makes a lot of sense that babies would have more trouble falling asleep. And there's a study from the UK during a heat wave that showed during these hot heat wave times, babies wake up actually more often during the night. If you've ever been with a baby overnight, you know that if they're waking up more often, you're also waking up more often. So that it has really important implications. But that study was great too, because it showed that following the heat wave, when temperatures went down, infant sleep patterns rebounded. rebounded. So again, this is not an all is lost situation. There is something we can do to improve children's sleep. And then finally, because kids' brains and bodies are developing really rapidly, these changes in their environments early can actually affect their mental and behavioral health across their lifetime. And this happens in part through if your stress activation system is set on high alert over and over again, and our bodies actually detect heat as a threat to our well-being, it activates that response. This can kind of disrupt these healthy emotional regulation circuits that are forming in young children's brains. And then there's really interesting data looking at how excessive heat increases rates of violent crime and suicide and in-home violence as well. And then you think about that just baseline effect on children's behavior. So when it's hot, how they behave, and then how that influences the interactions that they have with their caregivers. So we think about talking about ways to address these changes at 3 levels. This is true when it comes to temperature, when it comes to water, and when it comes to air quality and wildfires. And the first is protection. And this is thinking specifically about the populations that I talked about. So how do we protect people during wildfire events, during extreme heat days, and making sure that they're getting access to these alerts and that they have a room with clean air to go to and a room with a comfortable temperature to seek out. And then adapting both our services, but also our systems and infrastructure, thinking where are these little babies spending time and where are people spending time during pregnancy, and how do we make sure that they're adapted to handle the fact that this is going to continue to be a challenge to developmental environments. And then the third, and this is an interesting thing that came up recently in some preliminary results from a study that we're involved in with our partners at Sea Change and with the Frameworks Institute, is that we need to do a good job about talking about the root causes of why this is happening. So the burning of fossil fuels and the solution, being the other side of that, that stopping our burning of fossil fuels is actually a really important strategy in targeting and protecting children's health and well-being. So finally, I started out by saying I was going to make this argument that it's not just pediatricians, it's not just people who are working in early childhood. We're going to continue to do this as well. But I think that we can really paint a compelling picture that if you're in environmental protection, if you're in urban planning and zoning, if you're in criminal justice, it doesn't matter. Everybody's work actually affects the health and development of young children. And so every decision we make is going to shape a developmental environment for better or worse, because it's all of those things together, right? And so it's not just about what services we put in place to make sure kids get to their well-child visits. That's really important, but it's also all of these other things that we're creating, those totality of positive exposures and creating developmental environments where all kids have the ability to thrive in conjunction with their caregivers. So I really appreciate you having me. Thank you again, and look forward to the conversation.
Minutes, a couple of questions, so please feel free to jump in.
Hi.
Yeah, hi.
Thank you for an excellent talk.
Yeah.
So I have some questions about, maybe this is under the heading of migration.
Mm.
You've demonstrated to us that the impacts early, even prenatally,
Yep.
can have incredible outcomes.
Mm-hmm.
You also showed us that there are some programs and interventions that can give children, individuals, better outcomes.
Mm-hmm.
Is there an age, is there a time where there's a window of opportunity for the intervention? My experience with this is a little bit more about development of specific diseases and migration 14 years old and younger. But in the context of what you've described to us, what is your thinking around this? And then my second, perhaps a little bit.
We'll ask one at a time.
Okay, go ahead.
Yeah, I can't remember that much. No, I think, it's never too late, but that sensitivity and that timing slide that I showed, I think the emphasis there is that the earlier you are in development, the better you are in supporting all of the foundation for everything that comes later. So early in life, everything from being able to be consistently connected to your caregiver, to having access to, consistent nutrition, to healthcare that prevents you from developing these diseases. If you are able to do that in the earliest days, you're going to see that outsized positive effect. And so there's no specific age of development where I would say it's critical at this specific age to provide these specific resources, but I think that this developmental sensitivity can inform and tell us that for most of these interventions, the earlier we can support children, the better they're likely to do. But of course, it's never too late. You'd never, based on even the best science, say it shows us up to 14, well, we're not going to support a 15-year-old. There's always a chance to make outcomes better for young kids, and their brains and bodies continue to shape and are shaped by the environment throughout their lifetime, just like us. But, I think that's one of the reasons I love this center so much, is that we're trying to kind of raise an awareness to and explain how powerful this early period of development is.
Hi, I'm from the Graduate School of Education. So sorry.
Hi.
It's hard to find this place.
I can relate. Yeah.
My focus is early care and learning environments, and I'm really interested if you've been partnering with any sort of organizations that are helping to disseminate this information specifically to pregnant women and families with young children.
Oh, say the end. Pregnant women and children.
Oh, and families with young children.
Yeah, so we have a very cool partnerships and engagement team at our center that makes great connections with a variety of different organizations that are working as advocates. They're working with policymakers in the field. And so, yeah, there's a number out there that do great work. We could connect about your specific interests, and I can see if there's anything that we're doing that aligns, but the short answer is yes.
Awesome.
Yeah. Hi.
So, we're all here at the School of Public Health today, and so we're thinking about this, but I have sort of a piece of general feedback to figure out ways to make parts of it digestible for just regular people. Because I'll give you a real world example. I have 2 little kids, and if it's a summer day and it's hot, as a parent, and I have been to the School of Health many decades, and I think about, okay, should I be more worried about the temperature or their access to a park versus a little fresh air or the exercise? And at times it can feel paralyzing. What thing? Is it the air quality you're more concerned about, or the temperature, or that they need to actually exercise, or the green space? And at a certain point, it can be hard to know what is actually in the best interest of my child, right?
Yep.
And there's times you just have to do it. Kids need to move, or else
Right.
everyone in the house will melt down. So sometimes decisions made for us. But I put out there that there's so much great data, but within all that, it can be hard to know what just a parent should do.
Yeah, I totally agree. And this came up in a recent conversation I had about wildfires, where we were being asked, how do you think about in California now going outside with your child? If you have a baby and the air quality is not perfect and you have a toddler, do you stay inside where the air quality is perfect? Because that has implications for development if your kid can't get outside and you're not having any social connectedness. And so I think there actually is some combination of instinct and thinking about, and this is when I get too far into reading about mitochondria, I think what would my grandmother tell me is important about all of this? And so I think in those moments that maybe actually something that we can say to ourselves, to families, what does your kid need right now? I've never really met a parent that wasn't the best informed about what their kid needed at that moment, right? It's not for me to tell them, but I think it's kind of providing the information and the understanding and then saying, here's what we know, what does your family need? And one family's context is going to be totally different than another, right? These experiences are going to be completely different in a rural setting, and they're going to have totally different considerations than kids who are trying to navigate around urban heat islands. So I think it's not only family and caregiver specific, but it's context and environment specific too, because your access to these balances of positive and negative exposure is going to be really different depending on where you live and what your social infrastructure is.
So
Maybe one question, we'll take one.
Okay, I'm wondering about the opportunity index. That have there been interventions improving neighborhoods in specific areas of the index that have shown kind of good outcomes for the children, rather than just moving some families away?
Yeah, definitely. I think there's 90 studies now out of the COI that have looked at, that include intervention-based studies. And actually there's people in this room that I think are more expert at this than me. But yes, I can't quote all of them to you off the top of my head. But I think that...
Some of the specific areas, is it green space, or is it education, or...
Yeah, well, I think that there's neighborhood-specific studies that you could think about, but then there's also people looking at, what do we know broadly about these things, and how do we study them more specifically in children? Because when you look at the range of these environmental exposures and what we know about them in general, a lot of what we know is not specific to young children, right? So when people study access to green space, this much of it is about kids, and mitigating factors to heat, like this much about it is about kids, and this much is about people during pregnancy. And so I think there are people looking at these specific, like, what does it mean if you have increased access to green space, but I don't know about it at the level of, like, if you looked at this COI, neighborhood and created this intervention, how does that change outcomes for people in that specific neighborhood? I don't know if they've gotten that specific, but the report's incredible, actually, and if you get into it, you can, like, lose yourself a little bit, and if you're interested, you can check it out, but it's available online, free.
Great. Thank you so much.
Thank you.
So on behalf of the Lee Kumshun Center for Health and Happiness, I want to thank each and every one of you for coming to this workshop or talk. I also want to thank the audience on the webinar, I guess. And the next, we'll have, as I said, this is a continuing series. The last speaker is
on April 23rd, Ann Sussman. She'll be looking at architecture and designing for the subliminal brain for health, happiness, and well-being. So.
fantastic. So as you can see, we are bringing different kinds of people here. So thank you, Lindsey,
Yeah,
so
thank
much.
you for having me.
And also thank my team, Karina and Ayla, who worked very hard. Thank you all.